Hello, let's talk about the instrumentation I normally use when placing direct composite. This is the tray, and let's talk about each of these instruments. This is a very good articulating paper that I like because it marks wet. There's nothing magic about articulating paper. This is just one that's worked really well for me for a long, long time. This is the primer adhesive SB Scotchbond Universal, and the primer adhesive is in the same bottle. I personally etch separately. You can use 3-in-1 if you want to. I don't know if one works better than the other. If you're using this method, you're going to etch first, and then once you've etched, you're going to apply the primer adhesive and then blow it off into a 2x2. Once you've blown off all the excess, then cure it for about 5 seconds. And I'll say that again. Cure the primer adhesive before you apply the filled resin, and you'll eliminate sensitivity in teeth post-operatively.
Take your practice to the highest level with Dr. Cutbirth's online CE. Click on the link in the description below for dentistrymasterclasses.com. It only costs $20 per month, but right now you can join for just 99 cents. You heard me, 99 cents. So click below and change your life for the better forever right now.
You're going to etch with the 38% phosphoric acid, and you're going to etch dentin for 15 seconds and enamel really as long as you want. Normally I'll etch enamel for 45 seconds. Now what if you have enamel and dentin? Apply the etch to the enamel first, and then the last 15 seconds of etch, apply it to the dentin. You don't want to apply it to the dentin too long, or you can collapse the dentinal tubules and you won't get the hybrid layer when you apply your primer adhesive. I use flowable and highly filled resin. If it's a small composite, I'll use flowable. And many times, even if it's a larger composite, I'll use the flowable first and apply that to the floor of the preparation just because it wets so well. And then I'll come back with the highly filled composite and fill the rest of the restoration. Then I've used a Demetron curing light for 40 years. As I said, once I've blown off the primer adhesive, I'll cure that for about 5 seconds before placing the filled resin. Then once I place the flowable composite, I'll cure that for 20 seconds. And then if I follow that with a highly filled, I'll cure that for 60 seconds. That's probably overcure, but you can't overcure composite. You can undercure. So I want to be sure that I've cured it completely. This is a premier ball burnisher. This is magical for placing composite in a class 1 restoration. It's shaped like an egg, and this part just burnishes it beautifully at the margins, and it also removes excess. This is a Thompson plastic instrument. This is very good for transporting the highly filled composite and burnishing it, especially on a facial or a palatal surface. Cotton force pliers. You just use the cotton forceps to hold the cotton balls and wipe off any excess primer adhesive, or you can use it to actually wipe off any of the highly filled resin. So that's the dental minute. These techniques work, and they work every time.